Hey everyone, this is Emma. Today is Monday, March 16th, and as always, things continue to progress really rapidly. Things are getting more and more intense across the country for various reasons. San Francisco is now ordering residents to stay inside as the city tries to contain the outbreak. That's going to last until April 7th, and it takes effect at midnight tonight. As we continue to see more things like that pop up across the country, I think it's important to think about what we can all do before we get to that point and to figure out where we fit into the bigger picture. So I wanted to draw your attention to this article in CNA. It is called COVID-19 Could Force Difficult Choices on Healthcare Systems. And it does mention what we had heard coming out of Italy a little bit. It says, in northern Italy, intensive care beds are already filling up fast. Healthcare may be rationed. That is something that we have heard out of Italy from a couple of different sources, that as things continue, as hospital beds continue to fill up, they are going to need to prioritize who can have access to this care. Younger people, healthier people, people who have more life ahead of them, different ways that you want to say that, but they're valuing people at different levels. And that is something that happens everywhere and happens in ways that we don't necessarily understand kind of all the time, but right now it's an important thing to consider and to figure out how you fit into that picture. Down here in the section called Healthcare Q, it says that the U.S. Centers for Disease Control, for example, prioritizes access to limited stockpiles of pandemic flu vaccine by splitting the population into 5 tiers. So that means that we are already split up into these different sections where we are assigned a different value based on various things about ourselves. And this article does explain briefly some of the tiers. It says that Tier 1 occupants include military personnel deployed overseas, frontline healthcare workers, those in the emergency services and law enforcement, pandemic vaccine manufacturers, pharmacists, pregnant women, and children aged 35 months and under. In a severe pandemic, mortuary staff and energy infrastructure personnel are Tier 2, are favored over bankers and transport workers who are Tier 3. Healthy adults age 65 and under, or age under 65, if not included in a higher professional tier, rank the lowest. Interestingly, priorities can change according to the profile of a disease. Over 65s are Tier 2 in a low severity pandemic, but drop to Tier 4 in a high severity scenario. So I don't know where you fit into that, but I am definitely not a high tier person here. I'm definitely in the lowest tier, unfortunately. But as you can see, even in some of these changes that might happen that it mentions down here with low severity pandemics or high severity scenario, I think that we can probably assume that Tier 1 is going to include military personnel and healthcare workers. So let's take a look at what the military has been doing and what the military is doing right now and how that might be different from what we are being told to do. Here at the Air Force's Personnel Center is an article that says DoD directs stop movement in response to COVID-19, and this was published on March 13th, which is just 3 days ago. It says the Department of Defense issued a stop movement of all personnel to, from, or through Centers for Disease Control and Prevention designated Level 3 COVID-19 locations, effective March 13th and for the next 60 days. But now we've got a more recent one, published on March 15th. It says DoD officials explain new coronavirus domestic travel restrictions. So this first one that was released on the 13th was just to the Centers for Disease Control Level 3 locations. And you can assume that those are the countries that have high numbers of cases right now. But this more updated article is addressing domestic travel restrictions. It says that defense officials announced restrictions on domestic travel yesterday for service members, Defense Department employees, and family members in response to the new coronavirus, or COVID-19. Deputy Defense Secretary David L. Norquist signed a memorandum halting all domestic travel to include permanent changes of station and temporary duty travel. The ban is in effect from March 16th until May 11th. Officials speaking on background said the new memo said that service members will only be authorized local leave only. The ban is in addition to restrictions on all DoD military and civilian personnel and their families traveling to, from, or through areas for which the Centers for Disease Control and Prevention have issued a Level 3 travel health notice. Like I just mentioned, and we can click on that here if you wanted some more information about those regions, but you can see on their map what they're talking about, which is probably what you assumed they were talking about. But the fact that the DoD is now telling service members and DoD employees and family members to stop domestic travel, but that has not been told to the rest of us yet, even though it's something that we see coming. But seeing that these people that are valued higher than us are being told not to travel probably means that we should also not travel too. And I also checked out this other document from the DoD. It's Public Health Emergency Management within the DoD. So this is just addressing the military health system. But there's a section here about prioritizing delivery of medical care and authorizing situational standards of care during public health emergencies involving mass casualties. And it says the MHS Direct Care System has two primary objectives: to support the national security mission and to provide care for MHS eligible beneficiaries with MTF primary care managers. MTF commanders or directors will fulfill both of these primary objectives. However, during resource scarcity, critical mission requirements may necessitate a higher priority of national security missions over beneficiary care. Supporting the mission, under emergency conditions, the allocation of resources may not be based solely on medical necessity or risk, but also may be based on operational or other national security requirements as directed by the President or Secretary of Defense. Some service members, for example, may receive a higher level of care due to operational requirements independent of their immediate medical risk. So it's pretty clear that in some situations, military personnel, as well as some other folks like frontline healthcare workers, emergency service workers, law enforcement, vaccine manufacturers, pharmacists, and pregnant women may be valued higher than some of the rest of us. We can take a look at some of the other things that are going on in our country right now, including the fact that the Supreme Court has postponed arguments because of the coronavirus, citing the precedent set by the Spanish flu. This article in CNBC says the Supreme Court said Monday it will postpone arguments scheduled for March and early April, including cases regarding access to President Donald Trump's financial records, because of health concerns related to the coronavirus pandemic. The court cited its actions during the Spanish flu epidemic of 1918 and the yellow fever outbreaks of the 18th century as precedents. On a more local level, Denver and Aurora police are no longer sending officers to low-level crimes in an attempt to minimize the spread of coronavirus. Denver and Aurora police will no longer send an officer to take reports on low-level incidents in an effort to protect their staff. Both departments are encouraging people to report crimes online if they don't require an immediate response, and if no one is in danger. The departments can then follow up with a phone call without risking exposure of officers or the person making the complaint to the virus. Aurora police leadership said they would not send officers to a call unless there is still a crime in progress or it's a serious offense. The Denver Police Department started preparing for COVID-19 more than a month ago and has contingency plans should a bulk of their force become infected. And that is also happening in Portland. Portland police will stop responding in person to some calls, citing coronavirus concerns. The Portland Police Bureau announced on Friday that it will reduce the number of calls that officers respond to in person. It will instead direct officers to use the phone to contact people who have reported some types of non-life-threatening crimes. So here we have the military, we have the Supreme Court, we have police in Denver and Aurora, Colorado, as well as in Portland, Oregon, keeping themselves safe. Trying to not spread the virus amongst themselves and their organizations or their groups. And then we've got this nice article from March 11th last week. Super rich jet off to disaster bunkers amid coronavirus outbreak. Like hundreds of thousands of people across the world, the super rich are preparing to self-isolate in the face of an escalation in the coronavirus crisis, but their plans extend far beyond stockpiling up on hand sanitizer and TV box sets. The world's richest people are chartering private jets to set off for holiday homes or specially prepared disaster bunkers in countries that so far appear to have avoided the worst of the outbreak. Many are understood to be taking personal doctors or nurses on their flights to treat them and their families in the event that they become infected. Wow. Um, if only we all had disaster bunkers to go to, but we don't. So, this information about the super rich doesn't necessarily help us know what to do right now because we can't do those things. But the fact that these people who can do these things are doing these things, and people like police are not doing certain things, and the Supreme Court is no longer meeting, they're postponing these arguments, and most significantly, that the Department of Defense has announced restrictions on domestic travel for all service members, Defense Department employees, and family members, means that we should probably all either see that these things are coming to our areas, or we should kind of use them as warnings and probably stop traveling ourselves as well. Because the people who are valued higher in this tier system of, you know, what you can offer to society, what your chance of survival is, what your productivity is, what your value is, because we are all unfortunately assigned numbers and values in this world. We should be looking at some of those systems just to see where we fit in and pay attention to what the top tier people are being told and kind of heed that as warnings and take advice from that. So I just wanted to draw your attention to the fact that domestic travel has been halted for service members, and that's coming straight from the DoD. So you might not personally have that an order like that applied to yourself, but you probably shouldn't be traveling right now. But more than that, I have been recommending for a while that we look at some of these things that are being talked about that haven't yet been enacted and haven't been forced upon us, and we do use them as warnings and we consider what they're saying, because if we all acted on that information, if we all paid attention to what happened in China, if we all looked at what was happening in Italy and we acted accordingly because we assumed that was going to happen here also, there's still a big false perception that the United States is just so amazing, where our healthcare system pales in comparison to Italy's. And look at what's happening to Italy. We do not have the support network set up to survive something like this well. So we should look at what's happening there and change our daily lives accordingly before they have to force us to it, before they have to tell us to. Because if we stayed on top of that and we did it first and we thought of ourselves as part of the humanity, and we were in this with each other and trying to better everybody else and not just in it for ourselves or whatever, they wouldn't have to tell us what to do because we would have done it already out of the goodness of our hearts. So I would love to see more people paying attention and thinking about their neighbors and thinking about their global neighbors and the global population of humans and how we can all help each other without being forced to do it. But as we've seen in countless cities, a lot of people are not going to work right now either because their work closed, because they're being told to work from home or various things like that. And some of these people are taking the opportunity to say, okay, I'm going to go out to the bar in the middle of the day. I'm going to go out to eat with my friends all the time. And they're not considering things like social distancing, and they're not trying to stay at home more or whatever it might be. And now we're seeing restaurants and bars closed in lots of major cities and some states across the country because people are not doing these things for them. They're waiting to be told what to do. And if we continue to wait to be told what to do, they're going to tell us what to do, but they're going to force us to do it. And then who knows if those things are ever going to get better. If we think about the last time that something major like this happened that stopped the whole country in its tracks, that was 9/11. And what has happened since 9/11? A lot of stuff that hasn't gotten better. It's just continued to get worse. 9/11 was a long time ago, but what has happened to airports? Everybody's experience in airports keeps getting worse and worse and worse and worse. And now they're trying to force us into having real IDs. They're trying to force us into getting our fingerprints and our faces scanned to get on airplanes because that door got opened after 9/11, and it's going to continue opening because they got their foot in and we're not pushing back on it. So if we let them force us to do these things because we're not taking it upon ourselves to do the better things right now, to make the right choices, who knows if it's going to be something like that again. They've got their foot in the door, and a lot of this stuff might not go back to normal when the coronavirus is done. I really hope I'm wrong about that, but I really think that we need to take it upon ourselves to pay attention to what's going on in the entire world, and to pay attention to what our military is doing, and to consider that we should be responsible and make choices that are good for myself, for my kids, for that you might be able to hear right now because they're home, for my neighbors, for people in the state next to mine, for people in the country next to mine. So please think about how you fit into the big picture here. And don't forget to think about how you are valued to these larger systems that are going to be telling us what to do. Because if you're anything like me, you're on a pretty low tier there, unfortunately. I think I'm probably tier 4, so yay. But as I always say, please continue to figure out how to prepare yourself. It's a little bit different for everybody. Don't panic. This is getting really intense. There's a lot of stuff happening right now that none of us have ever seen before, and that a lot of people have been thinking is like a doomsday scenario. But so I think I rambled there a little bit at the end, but I hope that made sense. I'll put the links to some of these military things and these articles in the comments here on YouTube. And thank you for watching. Please share this video. And again, the comments are wide open. I would like to hear from you guys and see what you think about this stuff too. And if there's anything you want me to look at, please let me know. Thanks again for watching. Please share this video and stay calm and make sure you're prepared and reach out to your friends and neighbors that might need a little bit of help right now, okay? Thanks, guys.